Okay, so the first couple of shoulder tests we're going to be doing are sulcus signs. We're going to be doing this at 0 degrees of abduction and 90 degrees of shoulder abduction. And what we're testing for here is multi-directional shoulder instability. So for our 0 degrees, what I'm going to do is I'm going to use my forearm to stabilize the scapula. I'm going to use my middle and index fingers to find the coracoid process and acromion process of the scapula. And I'm going to be using my distal arm just kind of at the elbow space here to give a downward distraction force of the glenohumeral joint. And what we're keeping an eye on for is kind of a divot or a sulcus here just below the acromion process. This would be indicative of a lax superior glenohumeral ligament at 0 degrees. I could also test at 90 degrees by kind of putting the patient's arm over mine, clasping my hands over the patient's shoulder. I want to make sure I'm right at the humeral head here and just providing some downward force, nice and relaxed, there we go. Downward force, and again we're keeping an eye out for the divot or the sulcus right here, and at 90 degrees of shoulder abduction, we're testing more of the inferior glenohumeral ligament, and a positive sign would be a sulcus, which would indicate laxity.